Let's start with those bonuses for healthcare workers. How is it going to work, and how soon will healthcare workers enjoy that bonus?
So soon. We hope to have the payments made within the first quarter, so by the end of March. The context obviously is a very encouraging outlook on this Omicron wave, which hopefully now we're moving through. And it was felt that now is the time to do two things. First of all, and most importantly, to recognise the entire national effort. And that's through a bank holiday for this year and then every year into the future. And really, that's there to remember the more than 6,000 men and women who died, to reflect and really to mark the extraordinary efforts of a nation in dealing with what has been our greatest challenge in a very long time. And then the second piece, as you say, is it's a payment. It's a one-off payment, mainly for public sector healthcare workers who worked in higher risk settings, such as hospitals, who wore the masks, who wore the gowns, who went to work every day, putting themselves at risk. And it's a one-off payment just to say thank you to them for everything that they've done.
Yeah, the frontline healthcare workers also included in that: hospital porters, cleaners, ambulance workers, student nurses and Defence Force personnel as well, who are involved in testing and in vaccination, and agency workers too, I believe, who were within the public hospital system, we understand. However, will home care workers be eligible?
Well, home care workers, family carers, no, they're working within their own homes, they're working within family homes, but carers who are fulfilling HSE roles, so home care packages funded by government, funded by the HSE, they will be covered.
Right, OK. Well, first off, from Home and Community Care Ireland, who represent private home care providers employing around 10,000 carers up and down the country, they said they were awaiting urgent clarity from government on this. Can you give them clarity? Will employees be receiving that payment?
Yes, they will.
They will be receiving that payment. As for family carers, they have been described by their own representative group as the forgotten frontline workers. And they will be forgotten this time round, won't they?
Family carers are never forgotten. Family carers do an extraordinary job. And we're recognising, remember, everyone right across the country for a national effort.
They are being forgotten here. I mean, they have said, and it is true, that they played a hugely significant role in preventing a lot of people actually entering the hospital system, caring for their loved ones at home, doing this at a time when essential supports and services, respite and all of those things were simply not there for them. And they've said they were overlooked when it came to the provision of PPE, priority testing and vaccination. So what do they get? The extra bank holiday that they're not even in a position to take?
They have done an incredible job. This payment particularly, though, is for those frontline healthcare workers who were asked to go into higher risk settings. And I fully understand, I have huge sympathy for family carers. It's why respite services are there. But as you quite rightly say, a lot of the services that make things easier for them during the pandemic weren't in place for the reasons we understand.
What is going to be there for them now?
Well, this payment is specifically for healthcare workers within the public system largely who went into higher risk environments. So there will be workers right across the country, people who drove buses, people who went and worked in the shops and made sure there was food on the shelves. There are a lot of people who will rightly say, well, we contributed, and they did. But this is just a payment for those women and men who day after day went into those higher risk settings. OK, and
does it go for nurse and frontline workers in private hospitals, which were taken over by the HSE at the height of this pandemic?
No, it's not. The private hospitals obviously have played a huge role, and we really relied on them to take on a lot of the non-COVID care during the surges in particular. It's something that their employers may look at themselves.
Is it a bit unfair?
I think when you're trying to do something like this, when you're trying to recognise workers who went into COVID wards, who went into hospitals where there were a lot of outbreaks, who put themselves at that extra level of risk, no matter, you have to bound it somewhere. And no matter where you bound it, there will always be some people who you could say, well, surely this group or surely that group. Because, it's not black and white. There has been a continuum. But ultimately, you have to make decisions, and the decisions that were made were around public sector, the public sector hospitals, and just to be clear, it's not to diminish the extraordinary contribution from people in healthcare and outside of healthcare, but ultimately you do have to draw a boundary around it.
Okay, and the lines have clearly been drawn today on that one.